Now we will move on to our master, Dr. Prateep Vyas. Let's hear from him on what is that yield of information that you can get from the Humphreys field test. Over to you, Dr. Prateep.
Thank you, Satyan. Good morning, everyone. So Manish and Surender has done most of the job for me. I would be talking on the yield of information from the Humphrey field test. Get lots of information from this test related to glaucoma, related to retina, related to neurological conditions, and you perform the automatic perimetry to detect the pathologies in these three conditions only. So the standard definition of the glaucoma is the glaucomatous optic neuropathy with correlating visual field changes. So it's still the perimetry is the gold standard for diagnosis of glaucoma. That is what is the glaucoma is. Now in glaucoma, what do you do with the perimetry? You assess the defect and you analyze the progression. The quantification of defect and analysis of progression is very essential in glaucoma, because glaucoma is a chronic progressive disease and where the patient loses the vision completely. So when you get the printout of the perimeter, what would you see? First you give an overlook to this, and if you have these kind of fields available with you, I don't get any information out of this. But when you see this, the total deviation plot, the pattern deviation plot, the grayscale, all it's white. And if you look at here, then it's most of the black. And in the center, there is a small seeing area. But if you look at it carefully, you will see that it's a clover leaf defect where the patient has not performed the test well. And you can see that there are lots of false negative error. Just now, Venkatesh was asking this question, what about the false negative? So with the false negative, if the patient has glaucoma almost in whole of the field, then obviously they will get. If the patient is not attentive, then yes, you will get this kind of defect. Patient falls asleep during the test. And if on the contrary, if the patient is trigger happy, he keeps on pressing the buzzer while you are performing the test, then you get the white glaucoma. Then to get some more information, you can look at the gaze tracking, at how the patient was attentive during the test. And if the gaze tracking is like this, then obviously the patient was not at all attentive, and as well as your technician also was not very attentive. And the patient was continuously moving the eye. While you get very symmetrical pattern of the gaze tracking, that means the patient has performed the test well. Then what kind of a glaucomatous defect you get on the perimetry? So obviously, first you always see the grayscale, but obviously, the grayscale is for not for you. It's basically for the patients and their relative when you want to explain to them. But you would like to see the pattern deviation. It is the most reliable part. And look at here, what you are getting is a classical nasal scale, and here it's a superior arcuate scotoma with the split fixation. Look at here, when the first perimetry was done, there was a generalized reduction in sensitivity, and a couple of years later, totally everything has gone. So why it is so? You have to put your brain, because this was because of the media opacity and the patient has a cataract. You can see over here, the all pattern deviation was clean. Because of the media opacity, there was a generalized reduction in sensitivity. And once you have performed the cataract surgery and you did the perimetry, everything is gone. So when you look at the perimetry, yes, you want a food which is ready to eat, and but still you have to put your brain. So the ready to eat is here, the glaucoma hemifield test, which compares a few points on the superior meridian with the inferior meridian, the mirror images. And based on that, it says that whether the field is normal or it's outside the normal limit or borderline, and there are generalized reduction in sensitivity. So if for the outside normal limit, the P is less than 0.01, which is highly significant. So you get all the ready-made information on the perimetry, because the static is there and it's still evolving, so that you can become more and more comfortable. As I said, that the glaucoma is a chronic progressive disease So you have to do the progression analysis as well. So the first and foremost is important is just look at the overview printout. The overview printout gives most of the information where even by the grayscale, you can see that yes, the patient is over a period of time has progressed and the total deviation and pattern deviation plot on the progression analysis. So, but that has become pretty old. And now what we look for is the VFI, is the visual field index. The visual field index is basically is the function of the ganglion cell, and the ganglion cells are most densely packed in the central 10 degree. So that's why the more weightage is given to the central area as compared to the peripheral area, and it's a surrogate of the visual function of the patient. So this VFI is very important, and on basis of the VFI, the glaucoma progression analysis has been made. Glaucoma progression analysis is very good strategy to tell you about the progression, not only the progression, but the rate of progression as well, where you have to have at least 3 perimetry done. So the first one is the first field, the second one is the second, and this is the last field. And then you get the progression analysis, it's a linear regression plot based on the VFI, and then you can get the predictive value of what this patient would be doing 3 years or 5 years from now, because this patient has rapidly progressed. And obviously, yes, when you do not change the treatment strategy and patient continue to progress with the same rate of progression. So you can see that if this patient would continue to progress with the same speed in 3 years' time, we will go blind. And on the other hand, you look at this, where this patient is stable for almost 10 years, he has not progressed at all. When you have an advanced glaucoma patient, then what? You can see that it's like a floor effect. So in these is already discussed with you, and you have to perform NS2 strategy where you cover the 68 point. But here you don't get the GPA, and you have to depend on the overview printout. So there are some other conditions where you are dependent on perimetry, some retinal condition like the retinitis pigmentosa, where if you want to monitor that how rapidly the retinitis pigmentosa is progressing, you can perform the perimetry test. And then some neurological condition, like you can see that, you know, it's a bitemporal hemianopia. That means the patient has a pituitary lesion. And you can see here that this patient had AIOM, so it was an inferior altitudinal defect, and here it's a quadrant anopia. So in summary, the visual field analysis gives lots of information to us, not only related to glaucoma, but related to retina and the neurological defect as well. And it does a very good progression analysis. And the VFI has added in our armamentarium for the good assessment of the progression of glaucoma and the prediction of glaucoma, that what the patient will do 3 years or 5 years from now. Thank you very much for your patience.
Thank you so much, Dr. Prateep, for an excellent talk on what are the informations that you can get it from the Humphrey fields. It is just not enough. You just look at one fields and then say, okay, you have all the data. There are so much that machine can give you. So try to understand all the points, so that when you are doing your practice, you can understand what are the other things that you can just look at to assess the progress.